Dabel. I'm a nephrologist in Los Angeles, California. I'm also the founder and CEO of Cath Dry. Today I'm going to be showing you how to use the Cath Dry and giving some information. When you order the Cath Dry, it will come in a box like this, which contains 12 dressings. And you might also order the adhesive strips if you order it for showering and swimming, which also contains 12 strips. And you will also get an instruction manual which tells you how to apply the dressing safely. The best way to have the dressing applied is to bring the instructions and bring the dressings to your dialysis unit, and to have a nurse or a technician apply the dressing for you. So when you open the box, you will see the dressing, which comes in sterile packaging. And as long as it's not opened, it's sterile. Same with the adhesive strip, which is also sterile. At the dialysis unit, the technician or the nurse will follow sterile technique, which means they will be wearing gloves and a mask, which I'm not doing today for demonstration purposes. And I have a dummy here, which I will be showing you how to apply the dressing. One of the special things about Cath Dry that no other dressings have is that it has a water indicating ring, which starts off as white. You can't really see it here, but after I open the dressing, I will show you. And to open the dressing, there's a separation here, and you just pull apart, and then the dressing pops right out. And you can see there is a white ring that's a water indicator, and I've wet one for you. And as you can see, if water gets into the dressing, it turns very bright red. It can also turn red if you're sweating a lot, but it will be a light pink, and sweat is sterile, so that's not a big issue. But if water does get in, it will turn very bright red. So to apply the dressing, the catheter and the exit site will first be cleaned by the technician or the nurse with alcohol and sometimes chlorhexidine. Then to apply the dressing, you're going to remove 2 pieces of paper on the back of the dressing. There's the inner ring, where you will peel off 1 piece of paper and then another piece of paper. And then for the big ring, if you look on the side, there is, on the bottom middle, there's a little perforation where you can easily lift and remove the paper, exposing the adhesive for the larger ring. After this is done, the adhesive is exposed. You will then slide the catheter into the opening, which is sterile, and then slide all the way up until you are at the exit site, and you will center the dressing and then press on the skin. And this is the most crucial step that most people forget, is that there's a carrier on the backside of the dressing that must be removed. If it's not removed, this will not function. Water will enter the dressing, or the dressing will fall off. If you see where these orange arrows are, you have to press and peel the carrier off of the back of the dressing. And I will show you how to do that right now. So as you see, I lift, and then you pull it off. And you can see the little orange arrows in a clear plastic carrier. And then you must lift the other side as well. And you can see the little orange arrows. Now the Cath Dry is in place and solidified and will not be easily removed. The only way to actually remove the dressing is to start pulling on this little blue tab at the top of the dressing. If you start peeling back, then the dressing will be easy to remove. Otherwise, from just tugging on it, the dressing will not come off. It has a very good seal, which will allow you to safely shower and not allow any water to get inside.